how many of you know much about the Health Security Act? A few of you, okay. So I thought what I'd do is give you a brief history, talk about the act, what it would do, answer your questions about it, and then let's go into the politics from what happened this past session and what's going on. Does that make sense?
Yes.
Actually, the birth of this idea to set up our own health plan in New Mexico was created by two Santa Fe legislators, Max Call and Lucky Varela. They introduced a bill in 1993 called New Mexicare. And at the time, I was working with Consumers Union, the publisher of Consumer Reports magazine, and I directed the New Mexico Healthcare Project, and there was a bunch of us at that time, and Max was tired of what was going on with the budget, rising healthcare costs, education wasn't funded enough, Medicaid costs were up the roof, and he said, let's just do it. Let's set up our own health plan. And that bill actually, unlike many other states, there were about 20 states that had legislation, was actually very well thought out. At the time, King was governor, and so we had the advantage of talking to cabinet secretaries and trying to figure this out from a state perspective. And this is, there was no national health plan. At that time, Clinton had just been elected and was talking about his plan, which was managed competition plan. And so the bill actually got its first hearing, and it was just amazing what happened. It was down on the House floor, and it passed, much to the dismay of the insurance industry. And as they started doing, at the time, there wasn't email, but faxes and telephone calls. And we later found out they had fake phone trees. And so when it went to tax and rev, it was really, even the switchboard was burning down. So Max and Lucky decided to withdraw it. And there were Democrats that said, let's wait for the Clinton plan, let's see what happens. But several of us said, we don't think managed care or managed competition is going to work. And so we started traveling in different parts of the state and saying, if we are going to set up our own health plan in New Mexico, as a doctor, what worries you? As a business owner, what worries you? And we took that feedback, and the bill has been introduced. The next time it was introduced was in the Senate in 1997, and it's been introduced almost every 2 years since then. As a result, we've run workshops for people on the bill. We have, begged people, handed out copies of the bill with a table of contents and an index to seek feedback. And of course, there have been a lot of changes in healthcare in that time. When the Affordable Care Act was being discussed, our coalition got concerned that there needed to be a waiver provision within the Affordable Care Act, and we contacted groups in other states because we weren't sure that the Massachusetts exchange model was going to work in a state that's poor and with a small population. And as a result, Bingaman persuaded a senator from Oregon to put in a provision that's called the Waiver for State Innovation. I bet you never heard of it. That allows states to, in fact, do different things as long as it's not less than what the Affordable Care Act would offer, and you still get all the federal dollars, so you don't lose anything. And now, of course, we don't know what the situation is. And so what I'm going to tell you is the latest version that really reflects probably, 20 years of input from people from all over this state. And so what the act would do is enable New Mexico to set up its own plan. Not all New Mexicans would be included. Who would be excluded? The military retirees, and federal retirees. They would be excluded. There are two groups that can voluntarily come into this plan, The tribes are sovereign nations. We've had conversations with them, and they can decide whether this is beneficial to them. And then there are companies that come under a federal law called ERISA. States cannot regulate them. If they self-insure, like Intel or PNM, and they usually have a company like Presbyterian or Blue Cross Blue Shield that's called the third-party payer. They process the claims. The states can't, insurance laws don't apply to them. And almost every superintendent of insurance in the country hates this because they want to be able to protect people in these ERISA plans, and they can't. But they can voluntarily join. The estimates are that almost all New Mexicans would be part of this, and I'll explain to you why I think that ERISA companies would eagerly join. The services offered can be no less than what state employees have. And if you know what state employee services are, it's a high-end, wonderful package that includes acupuncture, chiropractic treatments. It includes good mental health, behavioral health provisions. It's just good preventive care. It's good to start with something like that. You would have no more networks anymore, complete freedom of choice of doctor and hospital, including across state lines. This plan, like any insurance plan, can contract with providers across state lines and around the country, with the Mayo clinics and whatever. It would be administered by a geographically representative citizens board. Nobody from the insurance industry can sit on it. Nobody who's elected can sit on it. It is a citizens board that consists of 10 consumer business interests and 5 health facility and provider interests. The fact that it's geographic is extraordinarily important, and it was Max and Lucky that insisted on that because they understood that setting up a health plan where Albuquerque and Santa Fe would dominate would make the surrounding areas uncomfortable. And I can tell you, traveling in rural areas, I sometimes get applause when I say, you're going to be well represented on this commission. So how is it going to be paid for? It's going to be paid for using existing public dollars. Not all of Medicaid. For instance, Medicaid includes long-term care. And this plan, because it's modeled after the state employees, doesn't include long-term care. So there's portions of Medicaid. If there are agreements with the federal government about Medicare, that would be possible. That would be possible. And then there's some state dollars that actually go into health plans and deal with preventive care that could be used to pay for the plan. The remainder is made up with premium sliding scale with a cap to it and employer contributions. Only people who are members of the plan are the ones who pay. So this is, if you're a military person, you're excluded, right? You don't pay. So that's a very different approach from California and some other states that have taxes across the board. Whether you're in the plan or not, you're going to pay. And so that's it in a nutshell. All of you came here by car. You pay for health care through your auto insurance, that you should just check it out when they give you your policy and see what percentage of your premium goes to health care. Workers' comp is a very big one. And this plan mandates that those premiums be reduced. Why? I'm in a car accident. I'm covered by the health security plan. So the broken leg is taken care of. I don't need to file a claim with my auto insurance, right? And they would always fight who's the payer of last resort anyway, and the lawyer would know about those things. But so that's mandated. The superintendents of insurance have been various ones over the years have been very aware that they, through findings of fact, will be expected to determine by how much that would be lowered. So you can see why someone like Intel is paying a lot of money. They're paying, right? They have rising healthcare costs. Might be intrigued to being in a health risk pool with about 1.8 million. They have 2,000 employees. And to get lower workers' comp and commercial automobile insurance. But all of this is not just going to happen. In other words, if the legislature passes this bill, this is not going to be set up. This is a very major paradigm shift for the state of New Mexico. And since the late 80s, what has happened is that in the first year, it's the numbers crunching year, first year, year and a half, to fiscal analysis. There have been 2 studies done in New Mexico by the legislature and the governor, one in 1994 and one in 2007. Both of them concluded, much to the shock of a lot of legislators in our poor state, that if we did one old-fashioned health risk pool with most or even all New Mexicans, we would save hundreds of millions of dollars within 5 years. I mean, that is no joke. So those numbers need to be updated. So that's the first thing that has to happen. And there are 2 pieces to this issue. One is the cost. What will it cost to cover 1.8 million people or so, assuming the services offered by the state employees? What will it cost? Then, how can it be paid for? What is the revenue source? And of course, with the Trump administration and the unknowns of how much federal dollars there will be, that's going to, there are going to have to be a lot of what ifs. The estimate is that, and I'll talk about this a little later, that this analysis will be finished hopefully by October of 2018.